I have TMJ problem. My jaw is tight. It's happening for me, 2 years now, and I've been so many doctor and nobody know what's going on and can help me. So and then I found you know, in YouTube. So I'll just come, give it a try, see if,
All right. So let's break it all down. So 2 years ago, what happened back then that caused the TMJ?
2 years ago, I went to a general dental to get the crown done. So after the crown is put in, and then found out one of the sides starting to get stiff and tight, and then it became worse and worse, and affect the right side. So and then I create a lot of tension all over like my whole head. I can't sleep. I can't eat. That's the worst nightmare. You know.
Understood.
And then I tried a lot of medication. It didn't work.
All right. So going back to it, how long was the crown procedure?
Almost 2 years ago.
No, how long?
How long?
Ballpark.
Okay. It's like a 45-minute long.
Okay. So,
yeah, because my mouth is opening.
So they kept your mouth open for 45 minutes?
Almost.
All right. Understood. Okay. Is there anything else?
I think that's it. And then ever since, that's my nightmare.
Understood. Okay. I believe during the consultation, there was something going on with your right foot.
Yeah, but that is a very minor. It's just that because years ago I went to Hong Kong and I slept 2 steps down, and then I have a little fracture. So, but right now it's healed. Obviously, it's healed already. So, and it's just that my complaint is that whenever I get up in the morning, first step I step on the floor, it's just I have a little bit sore pain. So after I walk a couple steps more, it's gone.
Okay, understood.
Start off with instrumentation. We're looking for any abnormal temperature due to inflammation itself. Inflammation is your body's way of telling you that you have something damaged and you need to heal it. Right? So one of the byproducts is abnormal temperature itself and also swelling. So right now we're looking for, is there any abnormal temperature? We found 2 spots already. One over here and here. Okay, you got a reading here. Okay. What happened here, by the way?
Oh, it's just I use a heat pad. I got a burn for it.
Okay.
So,
All right, so future reference, right? No heat pads.
Oh, no heat pad.
Okay, heat pads make things worse.
Oh, okay.
I want you to use ice pack. I know in our Asian culture, okay?
Warm.
Yeah, warm is better for the chi, stimulate chi and all that stuff. No,
Right.
in this case, no, it's actually making inflammation worse.
Oh, okay.
Right? So I want you to use an ice pack over here. Just wrap it up with a cold cloth, with a cloth. Apply it here for 20 minutes. But first things first, let me find where the potential problems are before we start icing stuff. Tender right here?
Yes.
Yeah. It's all on that side here. It's all swollen here. So that's what I'm feeling over here. Feel this over here?
Yeah.
Okay? That bump, right? That's all swelling right here. It's all swollen over here. Okay, so that sacrum in there is jammed up. It's not moving at all. Okay, this is fine. Okay, so you got the swelling right here. Right there. Sit back. Okay, relax. So yeah, I feel a lot of muscle tightness and swelling on the left-hand side.
I always massage myself on that part.
So your body trying to protect and stabilize something here, but this is damaged. So let's find out what's going on there. 6, 5. Tendon right here? Yeah, number 5. Yeah, see this? Tilt your head to the left. See, it doesn't move to the right. It's all stuck. See, this is damaged. All right.
We tend to refer to a couple things, and you may be wondering, says, wait a second, I'm here for the TMJ. Why are you checking my mid back, the low back, all that stuff? Well, the story is this. I always want to check what's going on with your foundation. So if your foundation is stable, your spine is going to be stable like this. And if it's unstable, it's going to cause a downward effect all the way straight up to the top of your head, and may also influence what's going on with your TMJ. That's why we need to check the whole entire structure itself. And I already identified, yes, you do have a problem right here at this sacrum. So because this is your foundation, it's going to impact everything else. That's what I also find here at the 5th dorsal vertebra as well. This one's knocked out. And this one also provides structural support for your neck. And this neck over here, I found a potential problem right at the 5th cervical. Why is that concerned? Well, this is what we call a trigeminal nerve. There's 3 branches here. Right? The one I'm more concerned about is the one all the way straight down here. This nerve over here innervates part of your bottom tooth,
Right.
bottom row, bottom row of your teeth over here. The middle one over here, it innervates the top portion of your teeth as well. So from time to time, especially when you do a crown or any dental work that may stimulate the nerves in your teeth, right? It may cause a feedback loop straight up your jaw, down into the spinal cord itself. Right? So when there's that feedback loop and it's not functioning properly as it should, it may cause that, the jaw to pop out of alignment.
Oh, I see.
Right? So that's why we do need to address this 5th cervical over here. Take away that nerve pressure off. Allow your body to recommunicate from the brain over here.
Okay.
All right. Send a nerve signal back into the jaw itself. Allow it to resume normal function, and that in itself should help alleviate quite a bit for your TMJ. We're still going to take a look at your TMJ itself, see if that needs correction or not. Right. In the same token, we're also going to correct these 2 as well. So identify a couple of things. Right? It's this foundation over here that's in trouble. So because of that instability, that's what we're seeing over here. The spine went this way to follow along, and then to compensate, that's what tilted to the right, hold it this way, left, and then right. You see that? This is not straight.
Right. Yeah.
So it had that downward effect. That's what we need to stabilize here first. The 5th dorsal, once again, because there's a curve here, there's another curve over here. That's what we need to address this 5th dorsal over here. We correct this one. Now, there's another thing I also want to point out is here. This is the 5th cervical. Right?
Okay.
Now, what I'm seeing over here is this. See that space over there, the height? This indicates there's a swollen disc over here. Right? And see this over here? There's a little bump sticking out. Right? So this is what we call the osteophyte. It should look like this, nice rectangle shapes.
Okay.
We don't have that here. We have a little sticking out. So what's supposed to be normal like this, and I'm seeing your spine did this, as you see over here. What happened? The tunnels start collapsing, okay? And all the swollen tissue surrounding it, the fluid, start pinching that nerve. I'm not saying severe enough, because when we start to have severe trigeminal nerve discomfort, okay, then that's what we call trigeminal neuralgia, which is more evident and more easy to point out because patients complain about, oh my goodness, it feels like someone put it like a hot poker, okay, something like really badly, burning pain or some kind of severe facial pain. So that's when it's like very severely pinched. But it seems like based on your symptoms and everything else, right, it sounds like it's just mild, very lightly irritated, just not severe or moderate. But based on what I see over here, this is something we need to address because what the osteophyte is, this is what we're looking at. because when the disc starts to get damaged, see this over here? It's no longer straight like this. See, it's nice and smooth, straight.
Okay.
Then it starts bulging out like this.
Oh, okay.
So when it starts bulging out like this, the body says, hey, wait a second, this thing's becoming unstable. Let's try to keep it into proper alignment. Make sure it doesn't spill over. It's no different from saying like, oh, it's okay. I don't want this thing over here. Start to like, oh, I don't want to fall over. So what the body does is it start creating these bone structures. See how it's starting lifting up?
Yes.
It's trying to push it, try to keep it back inside. So based on what I see over here, that bony part, it's telling me your body on the back part is showing that this part of the disc is going inside over here. And the body trying to shove it back into over here. It's trying to push it back in. And it's having trouble doing so. So what the long-term solution is, I need to realign that fifth cervical back onto this ball bearing. So instead of from here, we're going to realign it here.
Right, okay.
And we're going to do a very deep correction on that one.
Okay.
So that'll help take the pressure off of that one. Okay, next component. Okay, so the right foot. This is the one you mentioned about. You had an old fracture on this one.
Yeah.
So it looks like they, the doctors over there, they did a great job, letting it heal up because I can't find it.
It's just a very small fracture.
Okay, so we had a hairline fracture. So wherever it is, it healed up nicely because I can't find it. Okay, so all intents and purposes, this looks pretty darn great. Now, what I do see to help explain why you had that little problems with your ankle and the foot, it's this bone. This heel bone itself. Ideally, I want to see it line up here, but it went straight up.
Okay.
It's like this model over here. This is the same one, the right foot. Okay, this heel bone went this way.
Okay.
All right, so this is the one we need to put it down this way. Get things rolling. I'm gonna roll you over. Don't worry. This hand got you. You're not going anywhere. Right? All right. There you go. Relax shoulders. Let it drop. There we go. A little more deeper. Let it go.
Oh!
There it is.
Oh.
It's still rotated that way. My shoulders. Come on, I know.
Oh.
There it is.
Oh. I feel lighter. The neck, you just put it back in its place. Right now I feel a little bit sore, but I feel lighter, not as heavy as before.
Okay.
Even my head feel lighter.
Oh, that's what you mentioned about you felt the head
The
pressure.
head is heavy.
And how's that now?
Now it's feel lighter.
Good. How's the jaw?
Not as like tight, stiff as before. Like feel like a little bit loose up.
Good. How much would you say?
Before now how much is like from 1 to 10. Right now I feel like maybe 4.
And what was it before?
7.
Okay, so we basically cut it down by half.
Yeah, because before
Okay.
it's tight here, it's a little tighter, and then dragging up to my head.
Okay. Don't worry. We're going to take a look at that TMJ, right? Let's go ahead. Let's take a look at the foot. Okay, so let's take a look. All right, so that's stuck. All right, so talus is slightly fixated. Okay, not fixated. It's moderately stuck on that side. Calcaneus needs work. It's really jammed. Okay, we gotta correct this. So first things first, we're gonna pump it up. Hey, there we go. Okay, on your belly. Get a little more. Just relax, a little more. Ooh, Nelly, that was a beauty. Okay, walk around.
It's like a little flat on the floor, not as before. It's like feel the heel is up. Now it's like feel more like touching the floor. Like my whole foot is touching the floor. Yeah.
You like it? All right.
Yeah.
Well, we see the last part. The best part for last.
Yeah, the most part that's bothering me.
So we're here for the last main attraction right here. For the grand finale. Okay, open the mouth, close. Open, close. Okay, so here's a story with your kid. See, this on the left hand side is bulging this way, your right side is bulging out that way. Okay, open mouth, close, open, close. See, and this is not even moving too well. So first things first, we're gonna fix on your good side. Relatively, that's so to speak. Open the mouth, close, slowly. Okay, open, close, open, close, good, open, close, open, close, good. Now we go. Open, close, open, close, open, close, open, close, open. Close. Close. Okay, we're gonna do a little touch up. Stand up, please. It's your right side's a little bit impacted. Open. Slowly close. Open. Close. Close a little faster. Open. No. Open. Close. Good. Open. Close. Open. Close. Open. Close. There we go. Okay, give it a try.
Oh, definitely feel not as stiff as before. Before, even though when I open, I feel like the jaw feel like tight. Now, it's like normal, loose up. It's like you feel normal when you open up your jaw. Before, whenever when I chew, I don't have much strength on the left side when I chew. Like you mentioned before, the nerve affect the bottom of my teeth, and then the other one affect the top of my teeth. So that's why every time I feel the bottom of the teeth, I feel sore. Now here, it feels loose. Yeah, even though when I open my jaw, before when I open my jaw, I feel tight here.
And now?
Definitely feel looser before, looser than before.
You like it?
Oh yeah, of course. It's been bothering me for 2 years, so this is like a relief.
I'm glad you enjoyed it.